Vera Okeo is a senior health and sciences reporter at the Nation Media Group. Being the biggest news house in East Africa, what happens here impacts the region.
So the role of the journalists in the coronavirus outbreak is basically journalists are supposed to educate, inform, but particularly in the middle of an outbreak, your work is supposed to kind of like, first of all, work with public health officials and assure people of their safety. I have a desk that is dedicated to science reporting. I don't worry about meeting any other deadlines except the coronavirus. Oh, so I have two stories. One is about like these emerging diseases, like COVID-19 is an emerging disease. It's like the scientific community is thinking about when are we going to be caught unawares next, given in mind that UNEP says that every 4 months we discover 16, all over the world, 16 emerging pathogens, mostly viruses. So we're just from the editorial meeting, my story got approved, and now I'm headed to Kenyatta National Hospital. I'm going to meet Dr. Marianne Moreithi, and she's going to talk to me about emerging and re-emerging pathogens, because she deals a lot with those things, and where COVID is an emerging pathogen, and I'm sure there must be others.
Meet Vera, the scientist.
I would like to know from you, in your opinion, even though they're still hypotheses, where do you think this virus came from? And also, in your opinion, what do you think you and your colleagues, the scientific community, may have missed that made this thing become as big as it is?
Where it came from is still under investigation. The hypothesis is it could have been circulating within the animals, wildlife, that could not have been detected or had not yet been detected, and that's where our tasks are very important, this virus hunting, looking for these pathogens, but we need to be more rapid in our detection, and after being very rapid in detecting and surveilling, reporting. So we need a whole chain of communication between governments, policy makers, scientists, you, who is very crucial in the clog of all this that's happening, so that we can be able to advise and warn.
Every time I try to cover a story, I have a strategy. I want to make sure that it is diverse in terms of the people I quote, and then research. That is my strong point as a reporter. I would rather you have too much information about a topic than have too little.
Despite her well-researched stories, Vera continues to battle skepticism.
So health reporters have had to, walk through global health governance, geopolitical issues, economic issues, international public debt. So you have to mix all that up and hope that by the end of the day, your reporting is going to bring science to the fore and all those other issues below it, and try to get people to, remove all those things that are clouding their judgment.
Vera's story appears in today's edition of The Daily Nation, and it will be seen by millions across the country. It's a reminder of just how important journalists are in the time of a pandemic, with the capacity to inform and promote changes in social behavior. Responsible reporting can save lives.